So what is the new Botox face? I think probably you're thinking about Botox face being this over-frozen appearance or this Jack Nicholson weird devil peak look that you see. No, that's not really the new Botox face. So this is something I don't think most people are out there thinking about. Of course, you don't want an over-frozen face, nor do you want a face that has weird peaks. But there's some other problem. So the difference of the old Botox face, which is this over-frozen or weird peaky looking face, talks about short-term problems with Botox, but there are actually long-term problems with Botox. And what happens is the Botox actually makes your face look too good. You say, well, how's that a problem? Here's the problem. Because when you Botox only the upper face and you do nothing for the lower face, or you try to laser it to get it better, which does not work, you get a face that looks like a 30-year-old up here and a 60-year-old down here. So oftentimes we think about what makes someone look natural. People are always worried about looking overfilled or overlifted. But there's a better way to look at this too, or another as important issue, which is imbalance. Imbalance means one part of your face looks older than the other. So what we're talking about, the new Botox face, is the idea that one part of the face looks 30 and another part of the face looks 60 from a skin perspective. Of course, we can talk about facelifts, we can talk about fat grafting, we talk about other things to make from other cosmetic issues more balanced, but we're just talking about skin. So you don't want your upper third of your face to look significantly younger than your lower 2/3 of the face. So what happens with chronic Botox use? People think, well, it only lasts 3 to 4 months. I mean, what's the problem with Botox? Absolutely not. If Botox is done well, over time what happens is not only do the wrinkles shut down, but the pores, texture, tone, quality of skin get better and better and better with time. That's the power of Botox. It gets better and better with time. It shuts down molecular damage, rosacea, quality skin. If you're doing Botox for a few years, I ask you to do one thing. Go look in the mirror. Whether you have Botox recently or not, look at your forehead. You're going to see that your forehead looks flawless. You're going to say, well, Dr. Lamb, it doesn't look flawless. I got a couple wrinkles left. Look carefully. I see a little line here. No. Take 5 feet away, look at your face. What you're going to see is that from the color of your skin, the pores, the texture, the tone, the wrinkles, everything looks so much better than the lower 2/3 of your face. And the older you are, the bigger that difference is. If you're only 30-some-year-olds, you may just need that upper face treatment. But the older you get, that distinction becomes more and more apparent with time. And the more you do Botox, the better this upper face looks. So how do you prevent this? What do you do to make this look better? So remember what I've just said. This is a division between chronic Botox use and short-term Botox use. First of all, I encourage everyone to do Botox because it's such a powerful healing agent. And that's right, it's not a poison. It is actually a healing agent to make your skin look better. So chronically, it heals your skin because where do the wrinkles look the worst? Here. But what happens is when the worst area becomes the best area, that's a problem. So a lot of my patients that have much worse aging here, I start them on Botox and that's all they need to start with. But over time, if it gets too good, you need this area to match this area. So patients that have been doing 2-3 years of Botox, sometimes I tell them, look, back off on it. Use the other area to make sure they're in balance. So how do you fix this? So I'm going to divide the lower 2/3 of the face. Forget gravity, forget volume. I'm just talking about quality of skin. I'm going to divide it into dynamic problems and static problems. In other words, moving when your face is moving and when your face is not moving. So when your face is not moving, the things you're going to see in the areas that don't have Botox is worse pores, texture, tone, even some mild scarring if you have acne scarring, quality of skin, discolorations. When I do this micro Botox treatment, over time, your skin starts to heal itself. Maybe you skip a year, 2 years, but it starts to be really, really balanced. So you need less and less and less treatment. And so every 3 to 6 months or so, this micro Botox actually, I had a lady last year that she gets melasma every summer. She did 3 rounds of this. Even over the summertime, she didn't even get melasma. I've shut down rosacea. I've shut down pores, texture, tone. I had a gentleman I did a revision deep neck lift on that had a Mohs surgery with scar tissue and pores. I shut down both the scar tissue and the pores with Botox. How long do you think that lasts? Is it only 3 months? No. If you stop Botox up here, even though some wrinkles will come back, long term, that quality of skin is still there. There's an ongoing improvement of that skin with more Botox treatment. So I don't need to do this every 3 to 6 months. Over time, you need less and less and less. So from a static perspective, micro Botox is incredible. I used to try to use it for dynamic wrinkles, but it just doesn't work well enough. So this is a technique, I wish I could say I invented it, I didn't, it was from a Dutch doctor, but it's a cross-hatching method for these dynamic folds that really look so much better. When you start, at the end of this video, you'll see some before and afters, but when I can start to actually make those wrinkles disappear, it looks amazing. How long will that last? Once we build it, many years, I'm hoping, in most cases. Once I start the process of building it, it's a very unique way of doing it. So this is the concept of the new Botox Phase, is how do you create a balanced result from skin from top to bottom? And do lasers work? No. Lasers don't work well enough. Botox heals the skin and fillers manage it, because when you do a laser, how many of you guys have done a laser down here and said, well, the wrinkles didn't really go away. Oh, my skin still looks bad. And after a few months, it all came back. I do lasers. Lasers are important, but nothing like what I can do with fillers and Botox.